Chapter 24 for me, care of patients with disorders of the brain. Okay, well, we finished the chapter today, so I guess first things first, go to the questions in the back of the chapter and check that out. So that involves me pulling up Evolve and getting the answers and rationale. So if I get something wrong, I would know. Or at least can figure out how. Answer key. And open. Okay. Question 1. The nurse determines that the appropriate nursing diagnosis for a patient with status epilepticus would be risk for injury related to seizure activity. An appropriate expected outcome would be everyone will stay calm during the episodes, the caregiver will stay with the patient during the episodes, the patient will be free from any injuries associated with the seizures, standing orders will be obtained to medicate acute seizure disorders. Risk for injury related to seizure activity. Outcome. The patient will be free from any injuries associated with the seizures, because if that's the expected outcome, that's what you would hope for. There is no injury. And I was right. Intervention should prevent injury to the head or extremities from seizure activity. Alrighty, number 2. Nursing care of a patient who just had a seizure includes which nursing interventions? Select all that apply. Okay, just had a seizure. So, assess for injuries. You're not going to be able to reassure and reorient the patient. They're going to be asleep. Provide uninterrupted periods of rest. And I think that's it. Oh no. It's 1, 2, 3, and 4. Why? Why would you check the glucose level? Why? So you would orient the patient and check their glucose level? I don't get that. Generalized seizures, treatment, surgical, we want nursing management. Document, lifestyle changes. Okay, well it says right here, when consciousness is regained, reorient, and reassure her. You gotta document everything. But what does it have to do with glucose? I don't know. I don't understand the glucose. I can't find it in the book. It just says check the glucose level, if possible, and assess for injuries. What's the purpose of checking the glucose? They're not diabetic. Okay. Number 3. Which payment statement indicates the need for further teaching regarding the prevention of seizures? I need to avoid situations that could potentially trigger a seizure. Alcohol can lower the seizure threshold. Okay. Number 3. Which patient statement indicates a need for further teaching regarding the prevention of seizures? I need to avoid situations that could potentially trigger a seizure. Alcohol can lower the seizure threshold. I must avoid becoming overly fatigued and should pace activities. I am less likely to have seizures during menstruation. I don't know what that has to do with anything. Okay, I didn't know the question at all. Okay, apparently menstruation actually increases your likelihood of having a seizure. So, the correct answer is 4. You would need to teach her that you have a greater likelihood of seizures during menstruation. And alcohol does lower the seizure threshold. I didn't know that. Okay. Number 4. A blank is a tangled mass of malformed, thin-walled, dilated blood vessels that form a connection between arterial and venous systems. And I had no idea what this was. Arteriovenous malformation. And AV malformation is abnormal and the vessels can leak or rupture. So that's going to have something to do with either a TIA or a CVA. CVA, arterial venous malformation. It's a congenital abnormality and is a tangled mass of malformed. Just repeating myself. It can leak, causing an intracerebral hemorrhage, and can lead to further ischemia of the brain tissue and more neurologic impairment. So, it's just a different type of way a CVA can happen, apparently. Okay. Number 5. Which are true regarding an ischemic stroke? Select all that apply. The onset may evolve over a period of hours. A fibrinolytic drug may be given. Aspirin therapy may be started within 48 hours. Increased intracranial pressure occurs immediately. May occur as a complication of arterial fibrillation. So an ischemic stroke. I think it's an onset that may evolve over a period of hours. Ischemic, I don't think the drug would be given. Aspirin therapy would definitely be started. Increased pressure would definitely, ICP would definitely increase. And possibility, I do think it'll be after AFib. So 1, 3, 4, 5. Actually, it's 1, 2, 3, 5. So you would give the fibrinolytic drug, but it does not increase ICP. Oh, so ischemic is the clot that forms at the site of a plaque in the artery. Okay. I guess I didn't understand that. And then we learned that AFib can cause a clot to form because of blood flow not traveling properly. Okay, so ICP does not increase with an ischemic stroke, but definitely with a hemorrhagic stroke. Okay. A patient has had a cerebrovascular accident. The nurse assesses the patient's readiness for transfer to another level of care. The patient continues to have agnosia and apraxia. These clinical findings indicate that the patient would require assistance with undertaking activities of daily living, demonstrate independence in performing ordinary tasks, promote self to complete sequential tasks, not understand verbal communication. The nurse assesses the patient's readiness for transfer to another level of care. Clinical findings that indicate that the patient would. Clinical findings indicate that 1. Require assistance with undertaking ADLs. Yep. Agnosia. You can't recognize ordinary objects. And apraxia is the inability to carry out sequential commands. Okay. Number 7. Inappropriate nursing intervention for a patient with homonimus hemianopsia is nursing intervention to deal with a person that's partially blind after a stroke. Considering bold print additions, turning the head to scan both sides, avoid bright lights, wearing prescription glasses. Okay, well, if it's what Miss Lewis had us remember and it's half your eyesight down the middle, how would you help the patient? Maybe turning the head to scan both sides? Yeah. Apparently it is. Oh, okay. By turning their head from side to side, they're able to scan their environment more accurately than they would if they just kept still. They can assess better. Okay. Number 8. A 20-year-old man complains of sudden onset of fever, severe headache, and stiffness of the neck. Well, right then and there, that's bacterial meningitis. The nurse notes a petechial rash over the chest and extremities. Which nursing actions would be appropriate? Select all that apply. Institute standard precautions and droplet precautions. Administer antibiotics as ordered. Maintain a quiet and dimly lit patient room. Encourage active range of motion exercises. Administer narcotic analgesics for headache and neck pain. It is going to be the precautions, the antibiotics, and quiet lit room. Yep. Because that is bacterial meningitis. So you got the droplet precautions, antibiotics. Quiet environments helps lower the pain. You do not do range of motion exercises because that can exacerbate the pain, and you don't give narcotic medication because you will not be able to assess LOC. Right? Yep. A patient is admitted to the urgent care center for complaints of an abrupt onset of severe headache. Clinical history indicates that symptoms started during sleep and recurred several times during the day. These symptoms suggest brain tumor, migraine, cluster headaches, tension headaches. Well, I don't know anything about the headaches, so I don't know. Number 9. It is cluster headaches. So, awakening with a headache and then experiencing several headaches during the day is an indicator for cluster. Brain tumor occurs during the night and is unrelenting. Migraine lasts several hours. And migraine is also not recurrent during the day. Tension headaches tend to occur during the day and are either persistent or resolve and do not recur the same day. Okay. The nurse providing care to a 60-year-old Chinese patient with trigeminal neuralgia identifies that pain is the priority nursing diagnosis. The nurse anticipates assessing the level of pain based on facial expressions,